So next, let's move on to cirrhosis. So cirrhosis is a chronic end stage kind of a disease wherein there is diffuse architectural damage to the liver. So the word diffuse here is quite important. The damage to the liver is diffuse, not focal. It is diffuse, and the liver is converted into a nodular surface. So there is going to be presence of bridging fibrosis, which results in the formation of regenerative nodules. So damage and repair is happening simultaneously. So the entire liver is going to be converted into multiple nodules, which are the regenerative nodules separated by fibrous septae. So this is a diffuse process involving the entire liver. So this is the definition of cirrhosis. And cirrhosis can still be reversible if the inciting stimulus is being removed to a particular extent. Suppose alcohol was the cause for cirrhosis, and if there is cessation of alcohol, then the liver can come back to normal to a particular stage at least. So the various causes of cirrhosis are viral hepatitis being the most common. So viral hepatitis B and hepatitis C are the ones which are causing this viral hepatitis. Then we have alcoholic liver disease, then non-alcoholic fatty liver disease, then various metabolic diseases like Wilson's disease, hemochromatosis, alpha-1 antitrypsin deficiency, then autoimmune hepatitis, then biliary diseases like primary biliary cholangitis, primary sclerosing cholangitis, then also drug-induced liver injury, then other than that, idiopathic causes, which is called as cryptogenic cirrhosis. So we'll be seeing each of this in detail in a short while. So how do these cirrhotic patients present with? So cirrhosis will finally lead to end-stage renal failure or decompensated liver failure. So here the clinical features will be related to, initially they'll have some generalized features like malaise, anorexia, weight loss and fatigue. Then later on, the patient will start developing white nails. So white nails are also called as leukonychia, and that is going to be because of hypoproteinemia. So there is going to be hypoproteinemia in cirrhosis. This hypoproteinemia will result in the formation of white nails. Also, it will also result in the ascites. So ascites is nothing but fluid-filled peritoneal cavity. So there is going to be some hyperdynamic circulation related to splanchnic vasodilation. So here the entire hemodynamics is going to change, and that will result in the ascites. So hypoproteinemia is there. So that will also cause decrease in the oncotic pressure, which will result in the edema fluid, the interstitial fluid to be accumulated, which is called as ascites in the peritoneal cavity. Also, there will be easy bruising and lots of bleeding. So why? Because the coagulation factors is not going to be produced by the liver. So there are certain coagulation factors produced by the liver. So there is going to be coagulopathy in liver diseases. So that will result in easy bruising and bleeding. Again, liver cannot excrete bile. So liver, one of the functions of liver is to excrete the bile. So bile excretion cannot happen because liver functioning is not properly happening. So that will result in jaundice, and jaundice can in turn lead to pruritus. So intense itching throughout the body will be there in this. Other than that, we also have hyperestrogenemia. So estrogen metabolism is going to be affected. So that will result in certain clinical features like palmar erythema, then spider nevi, and also testicular atrophy and gynecomastia in men. Then other non-specific things we also are there in liver failure like bilateral parotid enlargement, Dupuytren's contracture, which is related to hemodynamic changes again. Then hypoglycemia, glycogen metabolism in the liver is going to be affected. That will result in hypoglycemia. Then asterexis, it is going to be flapping tremors. So the patient, if you ask them to keep the hand straight, they will have a flapping tremors. So that is asterexis. So asterexis usually occurs in liver failure associated with some encephalopathy. So some of the complications of liver failure will be hepatic encephalopathy, hepatorenal syndrome and hepatopulmonary syndrome. So in hepatic encephalopathy, you are going to have this coma, confusion developing. So why? Because the urea which is being produced in the body is usually metabolized by the liver. So it will convert it into ammonia. So ammonia, if it's not being degraded properly or excreted, so in that case, this ammonia will be accumulated, and this accumulated ammonia can cross the blood-brain barrier, and also it can lead to cerebral edema. So all of this will result in hepatic encephalopathy. So we also have other complications like portal hypertension, again because the vascular parenchyma, the hepatic parenchyma is being lost. So the hepatic sinusoids, the vasculature is also going to be altered. So that will result in the portal hypertension. So portal hypertension in turn can cause splenomegaly, and then there will be portosystemic shunts. So the portocaval shunts will be there. So bypassing this liver, the vessels will start forming shunts. So it happens at very specific sites. Example, in the rectum, wherein it can develop into hemorrhoids. These are called as varices. Okay, the shunts are called as varices. So in the rectum, it's called as hemorrhoids, and in the periumbilical region, it is going to appear like caput medusae. So from the center of the umbilicus, these veins will be dilated like this, and this is called as caput medusae. So, and also in the esophagus, lower end of esophagus also, you will have variceal formation. So when these varices are present, they can suddenly bleed. So it can lead to variceal bleeding, which can be torrential and even cause the death of the patient. So suppose there was a lower esophageal varicose, so and variceal bleeding is there, it can result in massive hematemesis. And finally, any kind of disease which leads to cirrhosis, if it's persistent, it can even turn into hepatocellular carcinoma.